Hello, everyone. Thank you so much for joining me today. My name is Grace Costello, and I am the Education and Volunteer Coordinator at Trellis. And one of the things that we have through Trellis is the Minnesota Aging Pathways call line, which I'll be talking about today. So thank you so much for joining me. We will start talking about how Minnesota Aging Pathways can help you. Minnesota Aging Pathways, formerly known as the Senior Linkage Line, is a statewide service of the Minnesota Board on Aging, in partnership with Minnesota's area agencies on aging. This means that no matter which of the state's 87 counties that you live in, Minnesota Aging Pathways can help you. We have call centers all across the state, so local staff can help when you are calling in. We have Dancing Sky Area on Aging in Warren, which covers northwestern Minnesota. Arrowhead Area Agency on Aging in Duluth, which covers northeastern Minnesota. Central Minnesota Council on Aging in St. Cloud, which covers central Minnesota. Trellis, where I am from, in Minneapolis, which covers the metro area. Minnesota River Area Agency on Aging in Mankato, which covers south central and southwest Minnesota. And lastly, Southeastern Area Agency on Aging in Rochester, which covers southeastern Minnesota. Minnesota Aging Pathways provides services that are free. So that means we provide services to any Minnesotan, and we are able to do this because we are funded through state and federal dollars. We are also neutral, which means we will not recommend one service provider or company over another. We want to give you options and help you choose what will work best for you. Lastly, we are objective, which means we will share all the information we have available and help you make an informed choice. Now I have some areas where we help that we can go over. So one area that we often help out with is transportation. So what this can look like is callers can call in and ask for transportation services, and we can look at what is available in their local area, whether that be certain community programs, public transportation, long distance transportation to Mayo, transportation for medical appointments, or helping people fill out metro mobility applications. When we look at these options, cost will vary. Private pay is the most expensive, but we can also look at sliding scales depending on your income. The next area in which we help is housing. So if you call in, we can help you compare your different housing options so you can decide if staying in home is best for you or if you need to move out of your house to a different location, whether that be subsidized housing, market rate housing, assisted living, or independent living. We can go over the options that are available in your area and help you decide what is best for you. Another common area in which we assist people is food help. So whether that look like helping you find a dining site so you can share a meal with other people in your community, or maybe you need to get connected to a food shelf. We can also connect you to different services that deliver groceries or get you connected to a ride to the grocery store. Another resource that we have connected people to the past is Fare for All. It is a pop-up grocery that offers items at 40% off retail. The next area that we have helped with in the past is house cleaning services, such as help washing the floors, cleaning the toilets, dusting, or help outside with snow removal or lawn care. All of these are ways to help you stay in your home so you can age in place. And then we also help out connecting people to support programs. These are things like SNAP, food support, maybe getting help paying for your Medicare, energy, and fuel assistance. We can show you your options and help you complete the paperwork to sign up. And we can help people resolve issues with the county when it relates to Medicare and medical assistance billing questions. We can also help when you become Medicare eligible, as we are the SHIP office for the state of Minnesota. We can help you answer questions about Medicare and compare Medicare Advantage plans. We also can help you if you have been staying in the hospital or a nursing home and you need to transition back home. Another area that's very popular in which we support is helping people who are supporting a loved one or friend. We can answer any questions you have about how you can support them, and we can share tools that will help you if needed. We also connect people to caregiver support groups, and we can give you information on how to become a paid caregiver if you qualify. If you have a friend, neighbor, or older adult in your life, give us a call and learn how we can provide resources to support you. If you are concerned about an older adult in your life, we can also help you make a vulnerable adult report. Another popular area in which we help people is helping them lower their prescription costs. So if you need help paying for any prescriptions, we can connect you to programs that help cover these costs, whether that be Good or X or Cost Plus drugs to help you afford your medications. And we can help people with this regardless of their age. As long as you are over the age of 18 and you call in, we can assist you with these services. And lastly, we assist with fraud concerns. So if people have concerns about Medicare billing errors or fraud, we can help you review your information and we can help you report it to the correct place. Next, we will go over some areas in which we cannot necessarily help. So while there is a lot that Minnesota Aging Pathways can do to help people, there are some things we cannot do, but we can direct you to people who can help you. So these are some common examples. We cannot enroll people in Medicare Parts A and B. To enroll in Parts A and B, you will need to go to the Social Security website, and we can help direct you to that if you are having issues. We can also not help enroll people in MSHO programs. If you are interested in enrolling in those programs, we will refer you to the health plan that you've chosen. We can also not advise people on spend downs, spousal impoverishment, estate recovery, or liens. This is something that you will want to reach out to your local county if you need help with spend downs, or you need to reach out to an elder law attorney to help with legal issues. However, we can help you find these services in your area and get you connected to them. We also cannot assist with cost-effective insurance premiums for medical assistance enrollees. That is also something that you need to go to your county for help. And then lastly, we cannot enroll people into a Medigap plan. If you're looking to enroll into a Medigap plan, you must contact the insurance company, broker, or agent that is selling that policy. Another big part of what we do at Minnesota Aging Pathways is helping people apply for programs that can make their healthcare and daily living costs more affordable. There are many programs available, but often the application process can be confusing, especially for older adults who are managing multiple systems like Medicare, Social Security services, and county services. We can help people complete and submit these applications. Our goal is to make sure that if someone is eligible for help, they're receiving it. And some common applications that we have helped with are energy assistance, Medicare savings programs, prescription assistance programs, and lastly, financial assistance programs. We also have a website where there is a live chat option if you prefer to use a live chat versus calling us on the phone. The website is mn.gov/aging-pathways. And that website in the live chat option is available from 8 a.m. to 4:30. Also, during the hours from 8 a.m. to 4:30, you can also reach us at our hotline, which is 800-333-2433. And when you call our hotline, you will hear an automated message that will prompt you with different numbers to select for different services. So if you are looking for moving help, you're going to want to press number 1. If you're calling for Medicare-related help, you will press number 2. If you are a medical professional, social worker in a medical facility, or in a nursing home, you will press number 3. And if you are calling for just general help and general questions, you can press 0. We also have some options to meet with Minnesota Aging Pathways, so we can meet you where you are. If you would like a staff or a volunteer member to meet with you and provide in-person assistance, we can do that. Our goal is to equip you with the tools and information you need so you can age in place. Most of our work is primarily done over the phone. However, if you were unable to resolve something over the phone, we do have Medicare counseling sites where you can meet up with a volunteer in your local area and compare Medicare Advantage plans. And another option that we have for meeting in person is meeting with one of our resource coordinators. And their job is to help you find resources and come up with a plan so that you can stay in your home. This is another website that we use. It is called mn.gov/add resources. This is a database of human service providers serving people across the state of Minnesota, and they all have been verified by the state. This website is what we use to connect people to resources. If you would prefer to use it on your own, you can always do that. You can search by category, whether that's housing, financial help, or home care services, and then you can enter your location and it will populate services that are in your area. We also have print materials that are available for free. You can connect with me if you want these materials for yourself or your organization after the presentation, or you can visit our website or call our hotline in order to get these in your hands. So the first one that we have on the screen is Planning Ahead. This has helpful information to consider as you age, securing your finances, securing your property, setting up a will. The next one that we have is Medicare 101. This book contains a breakdown of Medicare. However, it does not have any current updates to Medicare. It's just a general breakdown. So if you're looking for more specific Medicare-related questions revolving changes to Medicare, that's something you would want to call us and get answered. We also have Minnesota Aging Pathways kiosk cards. These provide a simple overview of how Minnesota Aging Pathways can help. And then on its flip side, it has the information about our database, mn.gov, add resources, where you can go to search on your own to find local services. And then we also have magnets available, and those have our partners on them and the phone numbers. So our partners are the Disability Hub and the Veterans Linkage line. We also have volunteer opportunities at Minnesota Aging Pathways. So some of the opportunities for volunteers are tabling at health fairs or giving presentations like I am today. We also have people helping out with filling out applications and providing Medicare counseling to those in the community. If you are interested in volunteering with us, we provide Medicare training classes for those who are interested in assisting with helping people with Medicare. And if this is something that is interesting to you, or you know someone who is looking to volunteer, they can always reach out at Minnesota Aging Pathways Hotline to learn more about what the volunteer process looks like. And then we also, like I mentioned, have different partner organizations that we partner with. These would be the Disability Hub and the Veterans Linkage line. We all work together to help people get the help they need. So sometimes you may start off with calling into Minnesota Aging Pathways, and you will be redirected to either the Disability Hub or the Veterans Linkage line because they might be able to better answer specific questions for you. They have their numbers on the screen, and if you ever have questions about getting connected to them, you can always reach out to us. All right, so that concludes the informational part of the presentation. I'll now offer this time to answer any Q&As, and then after the Q&A session, I do have some information in the forwarding slides, which I'll present on the screen with just a brief survey, which will ask you some questions about how the presentation went today. It would mean a lot to us if you would fill it out. We look at those answers and we use them to tailor our presentations moving forward. Once again, thank you all for coming, and I look forward to answering your questions on how Minnesota Aging Pathways can support you.
Thank you so much, Grace, for that insightful and informative presentation. As Grace has said, we're opening the floor for questions. Please share your follow-up questions or reflections in the chat.
I'm seeing the question. It looks like AD resources page is still under construction. There are a lot of providers' resources still missing. Any idea when the resources will be fully updated? Thank you. That is a great question. We still are working out some kinks. I have used it in the past week and I've been able to find providers that I was looking for, but there are some kinks that we are still working through. So we really appreciate your patience during this time as we've changed the name and the website links. Unfortunately, I do not have a set in stone date for when it'll be fully updated. I just thank you for your patience as we continue to update it.
Grace, what are some of the most common questions you usually get from callers?
That's a great question. So we get a variety of different questions from callers, but a lot of common areas we've been getting recently, of course, are Medicare-related questions, as a lot of people have been losing their UCare plans for 2026. So those people are calling in, and we are helping them compare the different options that are on the market. We also have a lot of questions revolving transportation, whether that's helping people apply for the Metro Mobility app, or there is a program where you can apply for reduced bus ride fees in the metro area, which we also have been helping people with. But we answer any questions. There's no question that is too small to ask us. I've had people call and ask about some things that you might consider silly. I had a gentleman the other day, and he wanted the phone number for the Philips Razor headquarters, and I was able to provide him with that. So there's no question that we turn away at Minnesota Aging Pathways.
That's wonderful to hear. Looks like there's another question in the chat. What tools or resources do you recommend for comparing Medicare plans during open enrollment? Phone call to you all to start. Would that be a good option?
Yes, I would recommend calling us. We can do phone comparisons over the phone for you. And then once we take down your information, we can either mail you those phone comparisons or email them to you so you have that printout that you can reference. Or you can also call us and make an appointment in person. We have different sites in the metro area where you can meet with volunteers who are specifically trained in Medicare, and they can do plan comparisons with you in person. So you can either do that in person or over the phone. And if you're looking to get started, you can call us at Minnesota Aging Pathways. So great question. Thank you for that.
So would you say that Medicare counseling appointments are better or more effective in person than via phone?
That's a great question. We get this one a lot, and my answer would be no. They are both effective, either way. I do let people know, though, the people that will be meeting in person are volunteers, whereas if you're calling the Minnesota Aging Pathways, that is our staff. So if you prefer to meet with staff over volunteers, staff are answering the phones and volunteers are meeting in person. But both of these people have been specifically trained in all the updates to Medicare. So both options are great. It just kind of depends on which works better for you and what you are more comfortable with.
Yeah, that makes total sense. There's a question regarding a list, if that is available to find online.
Is that in, okay, can you find the list online for in-person sites? Yes, so if you go, and I can put this in the chat as well, our website, Trellis Connects, if you go on there, you can register for in-person Medicare counseling appointments. I can find the link quick if you want me to put it in the chat.
Absolutely, that would be helpful. Thank you.
Yes, no problem. Also, if you just go to the Trellis website, there's a section that says Get Help at the top, and you can go under there and click Help with Medicare Counseling. But I will send the direct link in the chat. Just one moment. Okay.
Thank you, everyone, for your questions so far.
Yes, thank you, everyone. All right, so that is the link, and once you get to that web page, there will be an option to schedule an appointment on the phone or schedule an appointment in person.
Thank you.
Yes.
You did mention earlier, and I just wanted to ensure I understood that information correctly. So anyone above the age of 18 who, for example, needs help with medication costs can reach out to you. So you don't have to be 65 or older to reach out and ask for your help with any services or information that you can please share with a caller.
Yes, that is correct. So we help anyone as long as they are over 18 years of age. And it's been very common for us to be helping the younger population with affording their prescriptions. That's why we recently changed our name to Minnesota Aging Pathways versus being the Senior Linkage Line, because people were often confused that they needed to be 55 plus or 65 plus to access our services, and that is not the case.
Wonderful. Thank you. And then how do you, I'm assuming because you do offer in-person volunteer appointments, I'm assuming this is how you are able to help people who are not comfortable using computers or doing online research, or is there something else that you can offer in addition?
Yes, so we offer a meeting in person, or if people are calling in and it's not in regards to Medicare, but they need help maybe applying for something, different programs, we can actually get the information from them over the phone and fill out the applications on their behalf and then send them in for them. So that's another way that we help people with, who struggle online. A lot of times filling out applications online can be very confusing, especially if you have memory issues. So that's another way we help. And then we also can send mail outs for all the resources that we went over. So people have physical copies of the information that we discussed and the resources that we discussed with them.
Wonderful. It sounds like you're offering a lot of help and resources to everyone out there 18 and older. That's fantastic. It's really, I feel very honored to live in a community that is supporting, that has lots of programs in place to support everyone in the community. So thank you for all you do and all your help. I'm wondering if there's any other questions that people may have, or any thoughts that you would like to share, any follow-up questions in regards to Grace's presentation or in general. We have someone typing.
Okay.
So someone's asking if you can please speak a little to memory loss resources. Is there something you can share?
Yes. So, we have people that call in often that are loved ones that are going through caring for someone that has memory loss. And whether they're in the state of Minnesota kind of depends on how we support them. If you are in the metro area, we have a new initiative through Trellis that is called the Care Ecosystem. And we can refer people to this if they're calling at Minnesota Aging Pathways to this program. It's a newer program at Trellis. It is also a phone service where loved ones or people who are caring for people with dementia or people that are just starting their journey with dementia can call in and get help with immediate needs. They offer assistance with medication review and navigation support. They can also help supporting different behavior changes that might be going on in your life or with your loved one. They also can provide safety screenings and recommendations, support with the caregiver, just making sure caregivers are being supported in a journey as hard as taking care of someone with memory loss. And then we can also help navigate advanced care planning. And that's all through the care ecosystem at Trellis. But if someone called in and wanted memory care or memory loss resources and they weren't in the metro area, we would look for resources that are directly where they're at. But that's just an example of what's available in the metro area and specifically through Trellis.
Thank you, Grace. I really appreciate that you're able to tailor it to every caller's specific needs and quests. So I really appreciate that. I have one more question here. How do you assist with someone looking for an assisted living or care facility?
Yes, so we do this a lot, help people with assisted living or care facilities. So what we'll do first is find out where they're located, and then we'll go through some questions with them to just understand what they're really looking for in whatever living situation they're going to be transferring to. And once we understand what they are looking for, we can come up with a list of different assisted living, senior living, subsidized living resources for them. And we will print out or email all those different resources on a list for the person to just have and look through. Since we are neutral and objective, we cannot recommend like one living place over another. That's why we usually just give everyone all the options that are available that suits their needs, and then leave them to come up with the final decision that's best for them.
Very understandable, and I appreciate you emphasizing that you're neutral and you're not suggesting a specific facility. Rather, you provide them with multiple options and guide the specific person asking for your advice or for your guidance to making their best informed decision.
Yes, thank you. We really want to tailor each caller's experience, have it personalized so they can get the best help that they need and support them as they age in life. So,
Yes, thank you for that. Do we have other questions from our audience? That's a lot of information to take in for sure. Grace, is there a way for people to reach out to Minnesota Aging Pathways if they have something that comes to mind after our presentation? How can they get a hold of you or someone to help them with finding the right answer to their question?
Yes, so you can always call us. We have people that are answering the phones Monday through Friday, of 8 a.m. to 4:30. And if it's a question that can be better answered by staff or me, they can direct you and they can transfer you to me. So you can just call Minnesota Aging Pathways, say that you're looking to speak with Grace Costello, you were at a presentation, and they can transfer you to me, or they can answer general questions. But if it's something that is more suited to my expertise, since I was the presenter today, they will transfer you to me, and I will be happy to answer any additional questions after the presentation.
Wonderful. Can you please share that phone number one last time, please?
Yes, so it is 800-333-2433.
24. So 800-333-2433.
33.
Thank you. I just popped that number into the chat as well for everyone to reference to.
Awesome. Or you can always go to our website and do the live chat version too, if you'd prefer that.
Absolutely. Right. Would you like to go ahead and share your follow-up survey that you are inviting people to take?
Yes. So thank you everyone again for coming. We're just asking that people take some time to complete this survey. It's been approved by the United States Government Office of Management and Budget Control. It's 3 pages. Your responses are completely anonymous, and we just ask that people take this survey to help improve our programs and services. There's the link on the screen and the QR code, and then I believe there was also the link inserted in the chat. And then this screen has our number on it, the 800-333-2433, but I'll go back to the QR code in case anyone needs it.